We've used certain tactics we're all very aware of closing restaurants, closing schools and universities, stay-at-home orders, mandatory mask wearing, etc., to try to reduce the number of COVID deaths. And presumably that has reduced the number of COVID deaths. So I want to know, though, how many COVID deaths have been prevented. It's surprising to me nobody's done this. As far as I'm aware, nobody's done this yet. But can we make an estimate of how many COVID deaths we're preventing? And are we inadvertently causing other deaths? And can we make an estimate of how many deaths that might be? And we know we're causing, certainly, we know we've caused unemployment and unhappiness generally and loneliness. Can we quantify those things, and can we compare that somehow to the number of COVID deaths we're preventing? So that's the purpose of what I'm trying to do here. First, we need to know how many deaths we are averting. Ideally, you would do some kind of a controlled clinical trial. Ideally, it'd be a double-blind trial. That's impossible since people know whether they're in lockdown or not. But you'd compare two different societies where one does the strategy we've done of the stay-at-home orders, the mandatory mask wearing, closing schools and restaurants, etc., and another does not do those things, and see how much of a difference it makes in number of deaths. Of course, we certainly can't do a double-blind study and can't do a really controlled study, but we do have a comparison society that took a different approach than the United States, and that is Sweden. On this table, I've got a list of all of the things we've done in the United States and compared to what Sweden has done. We've got the stay-at-home orders, closing restaurants, closing churches, closing health clubs, closed non-essential businesses, closed schools, closed universities, and mandated wearing masks in public. Sweden did none of those things, except they briefly closed health clubs and they briefly closed their universities. They've not even mandated mask wearing. They only recommend mask wearing, and they only recommend it when you're indoors and cannot keep at least 3 feet away from other people, which is actually the WHO guideline on mask wearing. So the United States is stricter than the WHO guideline on that. So since they didn't do all of those things, presumably they've got more deaths, more COVID deaths than us, right? No, actually, on a per capita basis, per million people in the population basis, Sweden has fewer COVID deaths than the United States, and fewer than several countries in Europe that also took the lockdown approach. Now, some may say, well, that's because it's near the Arctic Circle, it's a relatively rural country. So, and we know that COVID transmits better in close quarters in more urban populations. So that's why Sweden has a lower death rate. Unfortunately for that argument, Sweden is actually a more urbanized country than the United States. Despite that disadvantage, they still have fewer deaths per capita than the United States. So from that comparison, you'd say that our restrictions haven't reduced deaths at all.